To demonstrate artificial respiration for an infant, we join a St. John Ambulance babysitting course.
Okay, so you're babysitting. You walk in to check on the baby. The baby's in the crib, and things don't look right.
Take charge, assess hazards, and make the area safe. Determine what happened.
So you're going to try and make sure that the area is safe, that the baby doesn't have any cords, any hazards that might be around.
Assess the infant's responsiveness.
Now let's try and wake the baby up. We're going to make some noise, clap your hands, yell at the baby. We're going to pinch the baby a little bit, flick their heels. This baby should wake up if they're sleeping. But if they're not sleeping, if they are unconscious, they won't wake up. There's no response.
Send someone for medical help.
If you're not alone, at this time, you could tell somebody that's in the house to go call 911. You need an ambulance. You have a baby who's unconscious, and you come back and tell me when you made the call.
Place the infant lying down on her back. Open the airway using the head tilt chin lift and check breathing for no longer than 10 seconds.
Now we're going to open the baby's airway using a little tilt. We're going to check for breathing up to about 10 seconds. We're going to be looking for any movement on the baby's chest. We're feeling to see if we can feel any air on our cheek, and we're listening to see if we can hear this baby breathing.
If the infant is not breathing, cover both the mouth and nose with your mouth. Make a good seal and give 2 slow ventilations.
I've assessed my baby's not breathing, so I'm going to cover the baby's mouth and nose with my mouth and give 2 slow breaths of air. First one goes in. The second one is going in.
Check for signs of circulation, including a brachial pulse or movement or coughing in response to the 2 breaths.
Okay, now we're going to check for circulation in the baby. We're going to try and check a pulse on the inside of the upper arm of the infant. We need to make sure that we remove any clothing because we want to be touching the skin with our fingers. We're going to check a pulse, if we can find it, with our index and middle finger pressing lightly.
Take no more than 10 seconds. Be aware that a pulse can be hard to find. If there is no pulse or you are not sure, do not delay. Begin CPR.
Anything that might indicate that this baby may have a pulse.
If signs of circulation are present, but the infant is not breathing, give artificial respiration. Cover both the mouth and nose with your mouth and give 1 slow breath every 3 seconds.
So open the airway again, back to the chin lift, give 1 breath, and count. 1, 1,000, 2, 1,000, puff. 1, 1,000, 2, 1,000, puff.
Recheck for breathing and signs of circulation after 1 minute and every few minutes after that.
Okay, I'm going to say it's now been a minute. We need to recheck for signs of circulation and breathing. So we're going to find the pulse if we can. We're going to check to see if the baby's breathing. The baby, if it's still not breathing, we're going to continue breathing. Okay, let's go. Breathe. Puff of air. 1, 1,000, 2, 1,000. Breathe.
Continue giving 1 breath every 3 seconds until the infant begins to breathe again, medical help or another first aider takes over, or you are too tired to continue any longer. In summary, begin with the scene survey and take charge. Assess responsiveness. Call for medical help. Lay the infant down and perform a primary survey. Open the airway and assess breathing for no more than 10 seconds. If the infant is not breathing, cover her mouth and nose with your mouth and give 2 slow ventilations. Check for signs of circulation. Take no longer than 10 seconds. If there are signs of circulation but the infant is not breathing, perform artificial respiration, giving 1 slow breath every 3 seconds. After 1 minute, recheck for breathing and signs of circulation. If the infant is not breathing, continue giving artificial respiration until the baby starts breathing again, medical help takes over, another first aider takes over, or you are too tired to continue any longer.